welcome to this auspicious event that we all anticipated a long time. Members of the head table, Chief Executive Officer of the Georgetown Public Hospital Corporation, Mr. Alan Johnson, Ms. Cassandra Alves, Chairperson of the Board of the Georgetown Hospital Corporation, Mr. Wilton Ben, Director of Nursing Education, Ms. Semple, Representative Social Protection, Ms. R. Chung, Manager, Human Services. Welcome, one and all. This morning, the privilege is mine to give you an overview of the Patient Care Assistant Program. Over the last few years, it has been proven that consumers within the community who require a level of care less technical than that of a nursing assistant and or a registered nurse need qualified personnel to enable them to achieve optimum level of functioning. In institutions, there is a level of care required for the residents which can be performed by less skilled and qualified personnel. Clinical care, such as attending to hygienic needs of residents, monitoring and recording of vital signs, among other aspects. Sometimes there are also non-technical duties, such as escorting selected patients to referral areas. Hence, the need arose for less qualified personnel to perform not so technical skills which would assist in meeting the needs of the residents. Thus, the program is designed to prepare the patient care assistant to perform basic nursing skills under the supervision of qualified personnel in order to meet the needs of the residents in the healthcare setting. The term patient care assistant refers to a person who has successfully completed a specified basic and recognized training and is certified in any healthcare setting under the supervision of a certified and qualified nurse. During training, the patient care assistant will proceed from simple to complex tasks. The purpose: to prepare a patient care assistant who is capable of giving basic nursing care to the residents, patients, clients, and families under the supervision of a qualified team leader in any healthcare setting. This program is designed to last for 6 months or 24 weeks, providing theory followed by clinical practice in order to form a linkage between the two areas of learning. This program commenced on Monday, April the 3rd, 2017, and we are on our 7th week successfully with 50 participants. Learning is reinforced through discussions and evaluation. Counseling and guidance are given continuously to strengthen identified weaknesses. However, participants need to always remember that if they are unsuccessful, they will not be recommended for certification and employment.
Our nurses are leaving now to go to the Caribbean, to go to the United States, to go to UK. But their nurses were leaving to go to the Middle East. Greener pastures in those days. So what do you think they were doing at that time? They were training up people to take away the non-nursing jobs from nurses so that nurses can concentrate only on the issues of patient care. When I came back, of course, I was excited. Our nurses were leaving in droves also, and I wrote a letter to the Minister of Health then, Miss Gail Teixeira, to our matron. But at that time, nothing happened. And years after, of course, I wrote my CEO, Dr. Shuri, at that time. And years after this course started, I like to believe that it had something to do with what I wrote so many years ago. So please forgive me that little nostalgia, and for me to now welcome you to this launch of this program, and to first of all say, thank my Madam Chair for being here, my colleague, Mr. Wilton Ben, and other colleagues, and colleagues on the left side of this. We all work together in healthcare and other places. So we're colleagues? Yes. You're not sure? Yes. Okay, we're all colleagues. We're all workers. I believe that this is what some of us will call a second chance to some of us. That so many of us didn't know what we will do or what will become of us, and we've been given a second chance. Now, what do we say in Guyana when we get a second chance? What do we say? I'm talking to the patient care assistants. What do we say now when we get a second chance? You don't know? Again? Make use of it. What else? Thank God. Thank God for it. Thank God for it. And having thanked God for it, what else you need to do? You need to focus and ensure that you do the best you can do, or outside of the best. You need to write every single down that is said, everything down that is said to you. Might not make sense then, but when you go home in the evening and you're looking back, and that's the second thing. Read everything you've written during the day in the evening. If you wait 2 weeks after, you might not even remember what you wrote. Revise, 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 revise. Work hard. As you heard, not all of you will make it. But if all of you strive and to work hard and to discuss things together, when it's a little difficult, you discuss it with someone else who you believe understands it a little better. All of you will make it. And I'm saying right now to all of you will make it. Because you're here with a second chance and you're going to grasp it with both hands. You're not going to let this go. Thank God you're here. But the patients will be happy for you also. Because as I said earlier, nurses are leaving. But we have someone now who can assist with when we trained our people recently. They're doing a little bit now of what nurses are expected to do. They have given them a little more. They have given them a little more. They don't want people to know. I'll tell you. They've given them a little more than usual. So they're doing they're doing work that the nurses do now. And we hope that you guys will qualify yourselves. We'll move to nurse assistants, those who don't have the full education. And we'll move on to become nurses. It's happened here, it can happen with you too.
You are a most well-mannered, courteous batch. That speaks volumes. We expect great things from you, we can tell. So good morning again. All protocol observed, and a special good morning to Ms. Mingo, because she's doing valuable work. We thank you. Yes. So the Minister of Public Health has asked me to relate to you that she's so sorry that she could not make it this morning. She had to go to the Berbice unexpectedly to deal with issues related to people who do work just like you do. all right? But she has written a very long speech, which shows how much effort she put into this, and she wants, she values her young people, and she really she wanted to be here this morning, but she couldn't, unfortunately, and she's asked me to deliver these remarks on her behalf. So please understand and know that she appreciates and values you. So on behalf of the minister, it is always a pleasure to participate in events such as this, and this morning's formal launch of the Patient Care Assistant Training Program is no exception. This program began more than a month ago and has attracted 51 of you, 50 females and 1 male. I wish our males were better represented. Our males need to be trained in this aspect of nursing too. So we will have to work harder to attract them for the next batch. We agree, right? I have noted that you've come from regions 3, 4, and 5, for which I am extremely grateful. And I can glean, judging from the expressions on your faces, that you are already enjoying this new acquisition of knowledge and skills, which at the end of the training stint will equip you to serve the patients in your care with more understanding and expertise. I would like in the next few minutes to engage you on the importance and significance of this training program to the Division of Health Sciences and, on a broader scope, to the Ministry of Public Health and the health facilities to which you will be attached. As you are aware, there's a deficit in our human resources, which, as CEO mentioned, and in other countries also, with regard to the provision of essential patient care in facilities such as Hugo Chavez Center for Rehabilitation and Reintegration. The need for trained patient care assistants has therefore become imperative, and it is to this end that this training program has been implemented to fill the existing gaps as quickly as possible. Further, some of you who have been operating at the PAMS Geriatric as patient care providers without any formal training have been included in this program in an attempt to improve your knowledge, because it has become increasingly evident that if we want our geriatric patients to derive the greatest satisfaction as inpatients, we must have a team of fully trained personnel on the job. Therefore, it is envisaged that more training programs will be designed for caregivers of the PAMS Geriatric Home, so that we have a core of trained patient care personnel who can give meaningful support to the nurses as they perform their medical duties. I am sure that you can all appreciate how critical this program is to ensuring that our patient care service is of the highest quality. And so I urge you to undergo this training with diligence so that you can execute your tasks with professionalism and finesse. This brings me now to discuss with you the rationale for your personal involvement in this program, the benefits you will derive, and the crucial role you will be expected to play once you have completed your training. I hasten to posit that your decision to become a part of this program must have stemmed from your interest in making a contribution to our inpatients by providing basic nursing care, and for some of you, your future advancement in your health career. Whatever the reasons are, the Ministry of Public Health appreciates your willingness and commitment, since your participation will help the ministry to fulfill its mandate to the people of Guyana, which is to improve the delivery of primary health care, of which patient care is an integral component. The Health Vision 2020 has objectives to which we have committed, and programs of this nature, with your input, can only further the cause that the ministry hopes to address and achieve. I alluded earlier to the growing demand for quality patient care service. It is a priority for achieving the overall objective of a high degree of patient satisfaction. How do you fit in, and what is your role? First and foremost, you must recognize that the patient is the most important person for whom you will be responsible. As a patient care assistant, you will provide direct and indirect non-professional nursing care or outreach services in the Hugo Chavez Center for Rehabilitation and Reintegration and the PAMS Geriatric Home, generally under the supervision of a registered nurse. In the first facility, you will be interacting with indigent persons who have no fixed place of abode, the less fortunate and homeless who may be in need of medical assessment and treatment, counseling and psychological assistance to enable them to become disciplined and productive members of society. In the second facility, as you already know, you will be providing care for the elderly who need more careful attention as they advance in age. Some patients may demand more care depending on their health condition, and you may have to assist with daily living activities, observing and charting changes in their health or behavior, and helping with hygiene and cleanliness. In a nutshell, Your duties will encompass a continuum of healthcare, health promotion, disease prevention, diagnostics, therapeutic and rehabilitative care recovery, and palliative care. Essentially, I would like to highlight your status. At the end of this program, you will be trained and recognized as professionals. You will be expected to behave like fully trained assistants carrying out your tasks responsibly. You will be expected to treat your patients with respect and dignity, always cognizant of and responsive to their needs and wishes, particularly for the geriatric. You will need to develop an empathetic ear, an effective communication line with your patients, creating a patient-friendly and caring environment where the patient can enjoy confidentiality and be respected for the informed decisions that are made. You will have to learn to be flexible, willing to continuously learn and think critically, ready to solve problems and react to situations with level-headedness and calmness. Moreover, there may be instances when you may be called to perform extra duties. Do not make it an issue, but respond with compassion. Your intervention may just be the response that eases the patient's state of mind. I wish to conclude by stating that providing patient care is a challenge that we must be prepared to accept. You must liaise with the administration to ensure at all times that the patient's safety and satisfaction are not compromised. Remember that your patient comes first and that you are critical to providing high-quality care with desirable outcomes. There must be a comprehensive approach to effective patient care service, in addition to the personal touch you will provide. The equipment must be in place and properly maintained. So too must be the instruments. They're vital to the performance of the medical system. Medication must be properly dispensed, and particular emphasis must be placed on the use of newer technology. You must never stop learning. You have to keep abreast of new techniques and technologies that will improve the quality of patient care. I'm sure that during your training program, you will certainly cover much more ground about providing patient care service. You will become au fait with the best practices in patient care and standards that have to be met. I have highlighted some of the expectations. I trust that this training will be a worthy investment, one which you will use to improve your rapport with those whom you serve. Last Friday, Guyana joined the world in celebrating International Nurses Day under the theme, A Voice to Lead, achieving the Sustainable Development Goals. You too are part of this important sector. You too have an important task to fulfill in ensuring that our patients at the PAMS Geriatric Home and the Hugo Chavez Rehabilitation and Reintegration receive the best possible patient care. You are contributing to their well-being and by extension to goal number 3 of the Sustainable Development Goals. So participants, I applaud all of you for being part of this program. And at the end of it, you will be empowered to serve your patients and by extension the people of Guyana. It is now my distinct pleasure to officially launch this training program. Best of luck to all of you. I look forward eagerly to the enhancement of patient care service on the completion of your stint in these 2 facilities. Thank you.
I am now joining the program. I've now been given the opportunity to be fully trained. I've been working there for a period of 10 years. And God has blessed me now with the opportunity that I can be fully trained, even though we had other training programs or so on. But now I'll be trained a patient care assistant.
Yeah, you would have mentioned that you're in your seventh week of training for the period. And how have you found it thus far?
Oh, it's very lovely. It's very lovely. It's very educational, and most of all, it's motivational. It helps me to get an idea of what I want to become more in the future, and even allow me to be able to think and put a lot of what I've been learned into practice, not only for the patients and the residents, but for myself as well, to start practicing the right things.
You're now joining, this is the first time in the program? Okay, and are you working anywhere?
At the PAMS.
How long have you been working?
6 years now.
What are you hoping that this training will do for you?
Well, I hope that this training will give us a better knowledge and way of, attending to our residents more efficient and effectively.
You're working at the PAMS as well?
Yes, 6 years.
What are you hoping that this training will do for you?
It could give me more on how to deal with the patient them, like mentally, because we have a lot of mentally challenged people in there. So, and it's something I love doing, so it will give me more insight on what we are missing out on.
So far, so good. I'm very been thanks for having this opportunity, and I will grasp everything because we have, from this 7 weeks, I've learned a lot, checking vital signs and learning to be confidential, because that is the main part. Learn to be confidential, and just want to put my best foot forward in everything I do. And
You're working at the Palms as well?
no, I'm not at the Palms. I just come openly. Okay, yeah. I'm not at the Palms and not at Hugo Chavez. Just come openly.
In the batch of all these ladies, is there any pressure to being a male?
Well, in a kind of way, at first I feel a kind of way because everybody was just watching at you. It's like, this is the only male, but just pay them no attention because I know what I come here for and I will work towards it, and in the end they might look at me differently.